Welcome to
America's Cannabis Conversation,
where you can hear experts from all facets of the cannabis business as to what's happening in this exploding industry. Keep yourself informed. Join the conversation. Hello and welcome to America's Cannabis Conversation Quick News. I'm Dan Perkins, your host. This report will focus on shockwaves that went around the world on COVID-19 vaccines. 3 internationally known pharmaceutical companies, AstraZeneca from London, Johnson & Johnson from the United States, Sinopharm of China, were all having difficulties and questions about the safety, effectiveness of their vaccines. Most recently, the concern turned to Johnson & Johnson, which this past week the Center for Disease and Control and the Food and Drug Administration suspended the distribution of the Johnson & Johnson vaccine because 6 women experienced blood clots within hours after taking the vaccine. According to the CDC, 6.8 million doses of the single vaccine from Johnson & Johnson have been injected so far in the United States. I may be skeptical, but I'm afraid there is more information to come, for this does not seem logical that 6 side effects would cause a total suspension of a vaccine from Johnson & Johnson. Do the math. Divide the 6 vaccines shots to 6.8 million shots, and you get an incredibly small, almost infinitesimal percentage. I do not want to come across as a conspiracy theorist. I'm just saying 6 people out of 6.8 million doses doesn't seem to be reason to suspend an entire program. Moving on to Sinopharm, which over the weekend reported that there was an adjustment in the effectiveness of their vaccine, which had been distributed to 500 million doses so far, to an effective rate of about 50%, which is a reduction from their previous higher estimate of the effectiveness of this vaccine being sent around the world. And last is AstraZeneca, a program that was never approved in the United States, but has been used in many other places around the world. Again, like Johnson & Johnson, a relatively few number of side effects with the AstraZeneca vaccine seems to be shutting down that vaccine for use. We have not seen any reaction around the world yet to the Johnson & Johnson suspension, but I believe we'll probably see more of that later in the week. The question becomes, are we left with 2 effective treatments, that being Pfizer and Moderna, are the only approved vaccines so far in the world, and can they catch up and make up the lost capacity of Johnson & Johnson and AstraZeneca? Going back to the Chinese vaccine for a moment, the Moderna and Pfizer vaccine cost about $40 for the complete package of 2. The most recent price quoted for the Chinese vaccine is $140 a treatment. I want to make one final observation. All of these stories about the effectiveness, safety concerns are bothering people more and more, making them more and more concerned about what vaccine to take, or should they take any vaccine. This is an important public health issue. We have to make sure that these vaccines are fully tested and safe for millions of Americans and billions of people around the world to use. Right now, I believe that trust is shaken. I'm Dan Perkins. Let's see who's joining the conversation today. First up is Stephen Schmitz, an MD and an MPH, a co-founder of Supplement Safety Solutions. For more than 15 years, he's worked on drug safety, and he does a lot of work with COVID-19. Did you ever wonder where the term 420 came from? Well, we've got the 2 guys who came up with 420. David Reddix and Steve Capper are the guys who created 420. Next for our returning business is our cannabis doctor on call, Dr. Jordan Tishler, and he's going to talk about how his shifting medical practice has been changed by COVID-19. Our final guest is Rachel Gillette, who's been on the show again before, and she's an attorney with Greenspoon Martyr. She's also the chairman of the firm's cannabis practice. He's going to talk about things that are likely to change if cannabis becomes descheduled. So let's join the conversation. I'm Dan Perkins. Thanks for listening. Welcome back to this segment with Dr. Stephen Schmitz, who was on our special on COVID-19, and he's back again to talk to us about what's going on. Doctor, welcome back to the program.
It's great to be with you, Dan. Thank you.
We want to talk this segment. We want to talk about what would a plan look like in a perfect world for an individual to give them the ability to empower themselves to get the best possible healthcare outcome in dealing with COVID-19. What do you think that plan would look like?
That's a great question, Dan. That plan would be multi-pronged. I think that plan would include following the usual recommendations of masking up and social distancing. It would also include access to testing, which is something we haven't had. I would also add, and we've talked about it in the earlier segment, that it's really important to take the measures to boost your own immune system, to maximize your immune system so that it can fight any kind of invader, whether it's a flu virus or COVID-19 virus. And then I also think it's important that people consider the vaccine. I understand there's a lot of confusion and hesitancy about the vaccine, but it is, and it's going to really change the nature of this virus because, as people have said, we need to get approximately 70 to 80% of herd immunity in order for us to really get a handle on the virus. So I think that's what I'd say, the multi-pronged approach.
And what about supplements?
When I mentioned earlier the immune boosting, I think supplements are important, and I think I am a big fan of two products from CV Sciences. One's called CV Acute, and one is called CV Defense. CV Acute is to treat, help your immune system fight a virus, so you take it at the onset of symptoms. And CV Defense is something you take every day, which basically keeps your immune system at an anti-inflammatory state and, again, ready to respond to a potential infection.
Doctor, I don't really mean to put you on the spot, but I'm curious as a professional what your reaction is with so many people not trusting the virus, or the vaccine, excuse me.
Dan, it really pains me. It pains me. I know there are a lot of reasons for that, but first and foremost, it's been developed at such an incredible speed. And a normal vaccine might take 3 to 5 years to develop, or longer. This one was developed in about 10 months. And so I think people are concerned that maybe there were some shortcuts taken on safety. But in my opinion, based on what I've read, has a very strong safety profile. Nothing is free of adverse events, and it's very effective. So when you're in the vaccine world, you balance the benefit and the risk. And so the risk would be some of these adverse events that have not been that common. The benefit is protecting you against a potentially deadly disease or infection or something that can cause prolonged disability.
Doctor, I've been asked that question that I asked you numerous times over the last month or so, and I have a different take than you do. Not that yours are wrong and that mine's right, just a different take. In May of this year, when the president announced Operation Warp Speed, Gallup and most of the survey organizations surveyed the American people, and 75% of the American people said they would take the vaccine. What happened that caused, I believe, was the significant decline to 50% or less interest in the vaccine was the campaign of Joe Biden and Kamala Harris. Joe Biden questioned the efficacy and the safety of the vaccine because it was developed under Donald Trump's offices. And we had Mario Cuomo, the governor of the state of New York, saying he would not permit the vaccine in his state until they tested it to make sure that it was safe. I think they undermined for political reasons, the safety and efficacy of the vaccine, and that put us way behind the 8 ball with tens of millions of people who don't have the confidence and believe in the virus. One person's opinion. And I'm not going to ask you to comment on it. I'm just telling you what I think. We've got about a minute left. So I understand in our last interview you said you gave us the 2 CV Science medications to your wife and children for Christmas. Why did you do that?
Well, first, let me just make sure these are not medications. These are dietary supplements. And I gave it to them because I love them and I want them to be around. And my younger son lives in Brooklyn. He's an aspiring artist. And the coronavirus is in Brooklyn for sure. And so I want him and my family to be around for a long time. I want their immune system to be as boosted as it can be by supplements. And that's why.
Good. Thank you so much for joining us. I'm sorry we're out of time, but it's been a pleasure to have you on. You've given us a lot of information. How can people follow you and what you're talking about?
Well, I have a consulting company that's called Supplement Safety Solutions. So if you want to write to me, I'm at Dr. Schmitz at supplementsafetysolutions.com.
If you missed any of this great interview with Dr. Schmitz, you can go to W420radionetwork.com, go to the archive section, and you'll be able to hear this interview, plus the other ones that the doctor has done, and learn more about how to protect yourself against the COVID virus. We'll be right back.
America's Cannabis Conversation. Each week, we provide our listeners information, education, and insight into the exploding medical and adult use cannabis industry. You'll hear from industry experts, elected officials, local growers, detractors, and more. Learn how to build your own cannabis business, how to grow the product, what's legal, and where it's legal. Time now for the lowdown on another high-time experience. Here's 420 lifestyle correspondent Rich Walkoff.
Hey, today we're going to do a little time traveling. Let's go back into the Wayback Machine, like 1971. The year the Pentagon Papers were published by the New York Times. The voting age dropped from 21 to 18. Starbucks opened its first coffee shop. And Richard Nixon launched his war on drugs. How'd that work out? Well, today we welcome in two of the original 420 Waldos 50 years later. I guess the war on drugs didn't work out too well, guys. And you guys coined a phrase that has lived beyond its years. Amazing. So thanks so much for making the time. Dave Reddix, Steve Capper, two of the original Waldos, and the 420 guys. So tell me how this came about. I know you've told the story 50 million times, but once more for the America's Cannabis Conversation.
We'll tell it one more time. This is actually, as you know, this is the 50th anniversary of creating the term 420. So back in the 70s, early 70s, we were... there wasn't much going on. You'd go to a football game on Friday night and cruise around and look for parties, right? So we're sitting under the grandstand smoking a doobie going, what are we doing here? There's got to be something better than this. So, Steve, go ahead.
Well, we first started with something called safaris. I was reading, my brother had Rolling Stone magazine, which in 1971 was total counterculture. Nobody got that magazine at all. And I was reading an article about down in the South Bay, there were some scientists that were developing the first holograms. And back then, 71, like images made, three-dimensional images made out of laser light, it's total science fiction. It said they were there 24 hours a day working on their stuff and they were excited. And so I go, whoa, what the hell? I used to take Cub Scout field trips. I'll go down and pound on their door and see if they'd show me they had a holographic city, a whole city made out of holographic light. So I went down there, I pounded on the door, and they just welcomed me and showed me everything they were doing. And we had a lot of laughs, and they go, hey, I'll go back and get the Waldos, and we'll all go down there. So the following week, I said, you guys got to see this. We piled in the car. Of course, we got high. We went down there, and we pounded on the door and hung out with these scientists. We had them cracking up, laughing. And we go, well, that's great. Something else to do besides go to the football game. So we decided each week we were going to do something unusual and different rather than the normal stuff. And Dave named these little adventures. Dave?
Yeah, well, we said, hey, this is kind of like we're going on a safari. Why don't we just call them safaris? So every week we try to come up with something new to do that's, we were like seekers. We wanted to do something fun, meet interesting, weird people and do weird things. And that's what our goal was.
So one day we hung out on a wall in the center of campus at Centerville High School. That's why we call ourselves the Waldos. We hung out on a wall. And one day I'm sitting
Oh,
on the
let's
wall.
preface that before you get there.
Okay.
We used to sit on this wall and breaks between class, and we'd watch all the people walk by, and we'd do impressions of these people, and we'd try to crack each other up as we watch these people going by. That was, we were totally into comedy. So
we created hundreds of catchphrases and slogans. And 420 was another one of our slogans. 420 is just the tip of the iceberg of our Waldo culture. Anyway, so sitting on the wall, a buddy of mine comes up and he goes, "Hey, my brother's in the U.S. Coast Guard out at Point Reyes. And for some reason, these guys, and they're growing weed. And for some reason, these Coast Guard guys think that their commanding officer is going to bust them. They don't want to get busted. So they decided to relinquish their growing patch. And they decided that Bill and his friends, which was us, could pick it. And the Coast Guard guy made a map of where the weed was. And I showed it to Dave. Dave got excited.
Oh yeah, it was like a no-brainer. You're 16-year-old kid. You have no money. Free weed. It's a no-brainer."
So what about the 420 moniker? How did that come into play? I mean, one would think it's 4:20 in the afternoon. Let's get together. Let's get high. And by the way, for those out of the Bay Area, San Rafael High School, about 20 miles north of San Francisco, in the epicenter of the counterculture movement back a half a century ago.
Right. So we not only were we, just Waldos, we weren't typical stoners. We're not Spicoli, at Fast Times at Ridgemont High. Most people think stoners, they're lethargic, they're lazy, they're forgetful. No, we were active. We're getting awards for exceeding in classes. We were athletes, everything. But we
weren't stupid stoners.
No, absolutely not stupid stoners. Not everything you see in movies. So a couple of the guys had football practice we got out of school around 3:00. It was a flexible schedule. Some got out at 3:10, some got out at 3:15. So a couple of the Waldos, they had football practice about approximately an hour. So we decided to meet. There's a statue of the chemist Louis Pasteur, who invented pasteurization. And we decided to meet at the statue of Louis Pasteur at 4:20 to get high and go find this weed that the guys in the Coast Guard were growing. So we would remind each other in the hallways all day long. We'd see each other and we'd nod, smile, we go, 420 Louis.
420 Louis.
And then, of course, we meet, we smoke, we go look for the pot. After about the third week of trying to find it, we just dropped Louis and we just smile and we go, 420.
We knew that we could use this little code. It was our secret code, and we could use it, in front of our teachers, our parents, cops. Nobody knew what we were talking about. We referenced 420 and we knew what we were talking about, but they didn't. So it was our own secret little code.
And it passed from us to our younger brothers, the class behind them. We went away to college. We used it with people, from other cities when we were away at college, and it spread. And then there's the Grateful Dead one of the Grateful Dead connections with Dave. Go ahead, Dave.
Oh, my brother Patrick, he was friends with Phil Lesh for like 50 years, and they're good friends. And in 1975, the Dead took about almost a year off. And so Phil started a couple bands. One was called Sea Stones, and the other one was called Too Loose to Truck. And he asked my brother Pat if he could manage them, and Pat said, sure. And Pat hired me to be a roadie for these bands. And we were getting high backstage with, I was getting high backstage with Phil Lesh and guys like David Crosby and Terry Haggerty of the Sons, who was in Too Loose to Truck. And I started spreading it around that way. And over the years, the Dead crew were using it a little bit, and then it spread out. So
and then there was another thing, Waldo and Mark. By the way, there's 5 Waldos. There's Dave, there's Steve, there's Mark, there's Larry, and there's Jeff. And you can switch out one Waldo for the other in an interview.
It's kind of like the Three Stooges. You could bring a Shemp in for a Curly.
It's kind of like changing deck chairs on the Titanic.
Yeah, well, but you're unlike the Titanic. So here you guys are, half a century later, as the merry pranksters of the day, and still retain that spirit of the '60s counterculture and the like. Can you tell me how cannabis played into that? I mean, it was a fun and invigorating and creative source of what you did back in the day. How about as it evolved in your lives?
Well, first of all, people these days, because it's just legal and people are buying at the store, and you're driving down the freeway and there's billboards for cannabis delivery. People forget how illegal it was, and we spent our entire lives looking over our shoulder, running, using our
secret places, and trying to score weed, and we knew you could get busted. You could get thrown in jail for 10 years for a joint back there in some states.
Building pipes out of watermelons, toilet rolls, and everything else. We were like outlaws. We were desperados, comedic desperados. And an interesting part of our story is Waldo Jeff. His father was one of the highest level narcotics officers in the state of California. So there's a whole interesting aspect of the story. One of the guys who started 420, his dad was a narc.
Jeff knew all about search and seizure laws. So he clued us into things like, if you have something in your glove box and it's locked, the cops can't ask you to open it without getting a warrant. And one time we were up at Lake Tahoe, Steve, me, and Jeff, and so Jeff and I went into the casino. We're at State Line, and Steve says, I'm going to roll some doobies, come back in a little while. And we split, Jeff and I, and then we started coming back, and then we see Steve with these Nevada sheriff's cars, a couple of them around the car, and they're trying to bust Steve. So,
there's a whole funny story there. That's kind of a long story. I don't know how much time we have.
Well, I'd love to hear an essence of, because this really, as I say, personifies the spirit of the time, where you had to be, it's like cat and mouse dodging the lawman. And today it's, part of the culture. It's so much more accepted. But the evolution is fascinating. And in a lot of ways, you guys in that time helped launch it. So I'm just curious how it evolved for you through the decades.
Well, we didn't know we were creating history at the time. All we knew is we were having fun. We were all about having fun and having adventures, So as the years went by, we started noticing, about 1996 or even earlier, we started noticing people were spray painting 420 on signs and rocks and carving it into benches. And one day, Waldo Larry Schwartz called up Steve and says, "Hey, this is everywhere. We got to do something about this, Steve."
So to secure the origins of this, because it went off into so many theories. Half the country thought it was a police code for being busted for marijuana or transporting marijuana or whatever. And then there were other theories. It was the time, I don't know, it's evolved over the years. The time Jerry Garcia died, not true. There's 420 chemical constituents and THC, which is the part which gets you high. So we said, we got to get the origin straight. So I wrote a letter to High Times, and the editor in chief, he flew out to California and documented. We have all kinds of physical evidence proof, and he documented this. And that was kind of the launch of the world beginning to get to know us. And then eventually Huffington Post and New York Times and LA Times, and everybody started examining further. And we have the history. We have it on our website, 420waldos.com.
And we keep all the physical documents of our proof in a safe deposit box at the Wells Fargo Bank in San Francisco. And guess what the address is? It's 420 Montgomery Street.
Oh, I love it. That's serendipity. And Lagunitas Brewery has a Waldo Special Ale in your honor.
Yeah, about 10 years ago, Lagunitas was doing some experimentation with different beers, and they were doing, like celebrity beers, like with Frank Zappa and family and other rock stars, and they had these psychedelic labels, and they're creating these beers. They were like, just one-off beers. They contacted us, and they said, "We'd love to do a beer with you guys." So we said, "Yeah, that would be cool." So we went up there and we picked out all the hops, and we wanted to pick the hops the dankest and smelled mostly like marijuana and tasted like marijuana. So we picked out the hops, they brewed it up, and they released it, and the rest is history. Because
we've been doing it for what, 7 years or 8 years now?
No, more like 9 years now.
It's seasonal. They start brewing it about a month or two before 420.
And it'll be in the stores very, very shortly. Last year, They didn't have it in the stores in bottles because of the pandemic, but this year it'll be in bottles and it'll be released nationwide because they have Heineken owns Lagunitas now, and they have a brewery in Chicago to cover the East Coast, and they have the brewery in Petaluma to cover the West Coast and all in between. So the beer should be out there. It should be on the shelves real soon. So go out and get a pack.
The carton that has the beers in it, I mean, it has our story on the outside. So there's the story is woven into all their marketing.
Now, it's not like the High Hops, which is a non-alcoholic beer infused with cannabis. This is how would you describe the Waldo Special Ale that Lagunitas makes? It's beer, but it's with the hops that you guys selected or preferred?
Yes. There's actually a video on our website of us going around. It's pretty funny of us selecting the hops. It's tragically hip.
Yeah.
So
tragically hip.
So you guys say that you belied that stoner, deadbeat image a half a century ago. What did you guys do with your careers? You five, the so-called Beatles of 420. What did you guys do with careers and lives and such?
Well, I started off in broadcasting. I was a disc jockey up at Lake Tahoe. And then I got into television production. I worked over at KPIX for a few years. Then I went to PM Magazine. I was a satellite producer and coordinator. And then I went to CNN, and I was a cameraman there, freelance and staff for about 20 years. And I worked with Don Knapp, like you said, Don. He was one of the greatest reporters I ever worked with, a great guy. So after they closed the bureau in San Francisco, that was about 2001, I went over to Tech TV for about a year. And then Paul Allen folded that company, and I've been an independent filmmaker since.
He's also a social director on a tugboat.
That's right.
All right. How about the rest of your buddies?
I had 30 years ago, I started from a 6 foot by 6 foot cubicle. That's a real specialty kind of finance company. It's accounts receivables funding in specialty niches. I've had it about 30 years. Right now, I'm actually the technologies that we've developed. I hope in the next 6 months that I can take these technologies to facilitate other people financing receivables in the cannabis space.
Sweet.
So see if I can put that together.
Awesome. How are you guys going to celebrate the 50th anniversary of your 420, pioneering efforts?
It'll be a virtual celebration followed by deli platters.
We probably, with the pandemic last year, we did some interviews, and I actually hooked up with Waldo Larry, and we were on the iPhone, and we shared a virtual joint. I'd take a puff and pass it to him, and he'd take it and pass it back to me. So I don't know what we're doing this year, but whatever it is.
Last year we did a virtual celebration with ArcView Group, which is kind of like the entire marijuana industry, not so much the public. And they want us back. They really want us back this year. So we agreed to do that this year.
We'll be on with Steve D'Angelo, the high king of weed, for medical marijuana and things like he owns the Harborside over in Oakland.
Right. Yeah, we appeal to a small select group of confused people.
Well, what's cool is that you're Zooming and you're on Zoom. So it's all how appropriate. Guys, it's been awesome catching up with you. Congratulations on this iconic half century of the 420 Waldos. You deserve all the accolades you've gotten, and great luck in the future. If you want to hear more or listen again, go to the W420radionetwork.com/archive. Rich Walcott with the Waldos, the 420 founders, Dave Reddix and Steve Capper. Thanks, guys.
Thanks, Rich.
Thanks for having us.
Happy 420.
Right on. We'll be right back.
Hello and welcome to your COVID-19 tip of the day. I'm Dan Perkins. Here are some of your questions that you've asked about the vaccine. Can a COVID-19 vaccine make me sick with COVID-19? The answer is no. The current vaccines in the United States do not contain any live virus that could cause COVID-19. Next question. If I get a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? No, neither the recently authorized and recommended vaccines nor others COVID-19 vaccines currently in clinical trials in the United States can cause you to test positive on a viral test. Our last question is, will COVID-19 vaccines alter my DNA? No, the COVID-19 mRNA vaccines do not change or interact with your DNA in any way. Listen the next time for What's in the Bottle. I'm Dan Perkins.
Want to find out if cannabis can help your medical condition? It's time to hear from our cannabis doctor on call.
Welcome back to the conversation, and joining us today is our good friend, Dr. Jordan Tishler, our cannabis doctor on call. Welcome, Jordan. Thanks for joining us today.
Oh, it's my pleasure. It's always lovely to be on the show with you.
Thank you. Jordan has been on probably more than any other person in the almost year and a half that we've been on the air. So it's always a pleasure to talk to him, and we never run out of things to talk about. So today I want to talk about indirectly about the pandemic and how it's changed physical health and mental health of the patients. And are you seeing any shifts in what you're treating with your patients today? So what do you think? How has the pandemic affected what you're treating in your business, if at all?
We see a lot of people with anxiety and depression. I would say that's second only to pain. So we do a lot of pain management, and then we do a lot of mental health stuff. And of course, both of those things can coexist and overlap in many patients. So yeah, there's definitely a whole lot of anxiety. And I think over the last year, the anxiety component of people's general well-being has really come to the fore. And so, every patient encounter starts with, how are you? And is everybody in your family safe and well? And I think that there's been a lot of that discussion. There's
Jordan,
also been, yeah, go ahead.
No, go ahead. I'm sorry. Go right ahead, please.
I was just going to say the other thing I've seen, which really is remarkably new and unfortunately not a positive, is that, because people have been home and isolated and frankly speaking, bored, what I have seen is a lot of people using too much cannabis. And so that has kind of tipped the discussion from sort of here's how you do this well and safely to, more like, okay, this is actually a little bit more than is good for you and is actually probably making your anxiety worse. So now let's talk about strategies to kind of get back on the right path. And that's definitely new. And particularly here in Massachusetts where, as you know, we have not only medical but recreational, which means that a lot of folks who come to me as a new patient have already been using cannabis, in a sort of do-it-yourself fashion, which I think really leads to problems, or potentially can lead to problems, particularly because the industry has a vested interest in pushing the idea that to use higher doses and more frequent doses. And we're seeing that, with the pandemic magnified because people are saying, oh yeah, I'm so anxious, let me go to the pot shop and see what they say. And then they go down there and they get a bunch of stuff and they try it, and it maybe makes them, too high and they feel more anxious, or they start using a whole lot of it and it makes them feel more anxious. And then they say, God, this really isn't working for me. Maybe I ought to find somebody to give me some advice. And then that's how they end up on my doorstep. So that they're unfortunately already a little bit behind the 8 ball before they even get in my office.
Doctor, one of the things that I've observed is how dramatic things have changed in the cannabis industry with the election of Joe Biden as president. and the open discussions about reform and decriminalization. Now, it came in with a lot of flurry, and we had the majority leader and Cory Booker coming out shortly after inauguration, talking about what their plans were as far as trying to put this on the agenda for this year. And yet now we're seeing some pullback on some of the administration officials about they want to make sure that they go at the proper speed here. And so there was a euphoria that we're going to see decriminalization and all the things that entails as far as criminal records and all kinds of things. But I'm curious from your perspective, since you live in a state, practice in a state that's both medical and recreational, would the decriminalization of cannabis at the federal level have any real impact in your state, do you think?
Oh, sure. Absolutely. I think that, there are a whole bunch of to this. First of all, decriminalization simply means that you wouldn't be arrested for possession. It means you could still get a fine, you just won't go to jail. And so that's sort of one thing. And then there's legalization for medical use. That's sort of its own thing. And then the third thing is legalization for recreational use. As you said, there's been a lot of discussion and enthusiasm about really legalization at the federal level. And I think that it's a double-edged sword, and I'm sort of pro legalization at the federal level, but with some caution and some caveats, because I think that we're in danger of going from no, you can't have this under any circumstance to sure, whatever you want to do, let's have a big industry and they can say whatever they want. And I think that those are two very polar opposites, and as with most things, the best approach actually requires some nuance and is somewhere in between. What we've seen with recreational states, Massachusetts, California, Colorado, it's all the same, is that the industry has then been allowed to say all sorts of things about what their products do, particularly in a medical sense, more so than in a recreational sense, even while selling it simply as a recreational product. And that's not good for patients, because patients need medications that actually do what they say. And they also need to get their advice, their medical advice, from somebody who knows what they're doing, as opposed to somebody who simply will say whatever it takes to make a sale. So I think that, when we think about the federal level, my hope is that we will accomplish many of the social justice aims, but at the same time provide some facility for patients to get what they need, and for doctors to be able to have the tools, like a prescription, to be able to make sure that those patients get what they need and not just whatever gets recommended to them at the point of sale. There's been zero discussion at the federal level about how to address medical patients. And that really upsets me, because, the social justice aims around people of color, et cetera, are hugely important. We also have to remember that people of color are traditionally given the short stick in the medical system, and that everybody is ultimately going to be a patient. And so having safeguards in place to make sure that patients are getting proper care is an important issue for people of color, people who are not of color, and sort of, broadly for all Americans. And I think we need that in place. And right now it doesn't make a good soundbite, so it's just not getting discussed.
Yeah, there are a lot of people that I talk to, Jordan, that are concerned that the differences in the legislation in California and Massachusetts and Colorado and Oregon and Washington and so forth is so dramatically different that if it becomes decriminalized, the word is that the Fed does not want to administer the law, and so that it's going to be the states are going to have to do this. But how we're ever going to put 50 states together under a common structure is a major concern about the people in the industry. And so many of them are, believe it or not, opposed to deregulation because the chaos of what's going to happen. The other thing is some of the regulators, and I've had a chance to have people from the Federal Trade Commission on the show, they right now feel comfortable about where we are as it relates to cannabis, but they're spending an enormous amount of regulatory time fighting the cowboys, as they call them, who are making outlandish suggestions about the power of CBD, and they're taking people to court all the time. Their concern is that if you open it wide open for cannabis, that the claims and everything else that we've seen in the CBD side of the market are going to wind up coming in the cannabis side of the market.
I totally agree with that. I think, the CBD market, which sort of came about mostly by accident in that, that the way that the law was structured in 2018 was, okay, we're going to make this not illegal, and now we're going to wait for the FDA to make some rules about how it actually gets handled, and nobody waited for the rules and nobody took them to task. Or the FTC, for example, is doing so, but it's a drop in the bucket. So I think that they're concerned that if we legalize cannabis as a national industry, we're going to see exactly that happen again, and that's unfortunate. It's crucially important that those kinds of claims not happen. The way I look at this is this. If you go into the pot shop like you would go into the wine store and you say to the guy behind the counter, dude, what have you got that's fruity smelling and that I'll really enjoy while I have my Saturday evening, filet mignon? I think that's a perfectly reasonable conversation to have with them. But if you go in and you say, dude, what do you have for my backache? You wouldn't have that discussion at Starbucks. You wouldn't have that discussion at your wine store. You shouldn't be having it at your pot shop, right? And so at least if we look at the pharmacy model a little bit, if you go in there and you ask the cashier, what have you got for my backache? They are very carefully trained to say, I'm not the person you need to talk to about this. Let me get you to the right person. And that right person in the pharmacy model might be the pharmacist, or it might be referring back to that patient's physician. And we need that sort of thing in the cannabis side of things, so that if somebody comes in and they want to talk about, the sort of wine-like pleasures of cannabis, then fine. But if we're gonna use this for any medical purpose, whether it's back pain or anxiety or sleep or any of those sorts of things, then they need to know, and it needs to be enforced that they don't talk about that. They refer back to the clinician. And this is part of the reason why I think we need a prescription, because that way, the doctor can not only be very specific about what the patient needs to get, but it also then, it's a requirement of the physician to be knowledgeable and to make that specific statement. And so it's a kind of a two-way street, putting the burden of knowledge and representation where it belongs with the physician.
Well, Jordan, unfortunately, time just flew by and we're out of time. Please tell our audience how they can get in touch with you and follow and some of that research that you've talked about in the past.
Sure. All comments and curses are welcome. The way to reach me is through my website, which is inhalemd.com. Again, inhalemd.com. On the website, we've got hundreds of articles on cannabis and its use for various problems, risks and benefits, and all those sorts of things. It's a really good place to get your toe in the water. Again, inhalemd.com, and you can reach me directly through that website.
Jordan, it's always a pleasure. Welcome back.
Thank you so much.
If you missed any of this terrific interview that just flew by with Dr. Jordan, you can reach us reach out on W420radionetwork.com and go to the archive section and listen to Jordan in this particular interview and many of the interviews that Jordan has given us. We'll be right back. This is Dan Perkins with your Songs and Stories for Soldiers, Veterans Tip of the Day. The VA is working closely with the Center for Disease Control and Prevention and with other federal partners to provide COVID-19 vaccines as quickly and safely as they can. The VA knows that you have lots of questions and information is changing so fast, so please check back to the va.gov website for updates, and they will continue to update the website on a regular basis to give you the latest information. If you find yourself not enrolled in the VA but you need a COVID-19 vaccine, then go to the va.gov and locate the nearest VA facility to you so you can reach out and find out how you can schedule your vaccine shots. If you happen to be not only a veteran but a spouse of a veteran or caregiver or a CHAMP VA recipient, the VA will contact you and let you know when your vaccine shot will be ready. This has been your Songs and Stories for Soldiers, Veterans Tip of the Day. This is Dan Perkins, and thanks for listening. Welcome back to the conversation. Joining us today is Rachel Gillette, who is the chair of the cannabis law practice of Green Spoon Martyr in Denver, Colorado, but she practices law all over the country. And I invited her back today to specifically talk about the potential regulation and possibility of corruption in the cannabis business. So, Rachel, welcome back to the conversation.
Happy to be here. Thank you.
My pleasure. Let's talk about corruption. I personally believe that when you open the gates, when the Fed eventually takes away the controlled substance and allows for safe banking and all these other things that are real businesses, you're going to have an explosion of growth across the country. You're going to have products sold back and forth across state lines. And there are some people who are interested in local regulation, and I have grave concerns that one of the problems, because of the vast amounts of money involved in this business, that the corruption, it could be the worst at the local level. What do you say?
I don't necessarily agree with that. So let me give you an example. So in Colorado, we've always had something called the local option. So when we determined our medical licensing scheme back in 2010, the state determined that the local jurisdiction could determine if they wanted to issue licenses, what type of licenses they wanted to issue, where they wanted those licenses to be, and how many. They could potentially put caps on. This could be done by vote of the people. It could be done by their electors, meaning the people, the county commissioners, the city council members, could pass an ordinance to allow cannabis. Now, in Colorado, we have a number of jurisdictions that do not allow cannabis businesses to exist. I'll just say, on day one of adult use, we probably had less than 20 jurisdictions that decided they were going to allow medical marijuana businesses to sell adult use marijuana. That list has grown over the years since adult use passed, and it is now probably 50 or 60 jurisdictions, I want to say, that allow marijuana businesses in some form or fashion. Now, where I think that's good, because communities can determine what's good for them, where these businesses should be located, et cetera. I think it's good for the community to have a say. Where I do think there's more opportunity for corruption, and just to say, I would call Colorado kind of a free market state. But to compare, you have other states that are what I say are closed jurisdictions. They are competitive licensing states where the state has said, we're going to issue 4 cannabis licenses, and we're going to take applications from this period to this period. We're going to require you to submit all this mumbo jumbo that nobody ever follows up on or determines whether or not, the winning applications actually did what they said they were going to do in their application. And then they limit the number of licenses per state. And then you have this competition, essentially, for the few licenses that are going to be issued in a particular state. And we've seen this in a number of states: Florida, New York, New Jersey. New Jersey's about to do it again, I think, which is unfortunate. You know, a bunch of other states that have decided they're going to make people essentially compete for these licenses. And so you have a grading system, a handful of winners. Oddly enough, you see a lot of corruption and lawsuits that arise for the people that don't win the licenses. It's an arbitrary grading system, and it just doesn't work. Compare that to a state like Oklahoma, where essentially they have requirements where, you know, they have certain qualifications to own a marijuana license. If you can find a local jurisdiction and a permit and you meet those qualifications, you can apply for a license in Oklahoma. Same with Colorado, same with California, same with a lot of the western states. Those states are more free market. Guess who has the most robust marijuana markets, and guess who has the best quality product out there, because we have some level of free market competition? It's Colorado, California, like those states. And we have really great businesses and a very robust industry with lots of tax revenue being raised, et cetera. Where there's a lot of problems is in those states, and I do think that corruption exists, but it's in those states that did these competitive licensing schemes. And then what ends up happening is the lawsuits get filed by the losers of the applications, and then there's a delay in the processing of the licensing, and then licenses don't end up being issued, and then medical marijuana patients don't have access. People are still buying on the black market. There's just so many things that can happen as a result of those types of licensing schemes. And frankly, I just think it's kind of silly. I'm one of those people that believes in the free market. I think it's okay to allow a local jurisdiction to have a little bit of say on, you know, the manner and the place of where their cannabis businesses might be located. And for the most part, we haven't seen that type of corruption. I'm sure it happens at the local level to some extent here and there, but I don't look at Colorado as a state that has, you know, a problem with corruption in the issuance of these licenses, because anybody can still apply, essentially, as long as they're qualified and can find a local jurisdiction to give them a permit.
Rachel, I understand what you're saying, and I appreciate what you're saying, but one of the things that I've noticed in the last year of the states who have decided to either allow medical and or recreational marijuana, there seems to be in almost every case rules about equity in the licensing application, that minorities are discriminated against. And if the licensing process is so restrictive that blacks and minorities can't get a license because they're black and minorities, isn't that a problem of, it may not be corruption, but it's certainly creating a problem of equitable, as they talk about, equitable distribution of the licenses?
Well, here's what I agree. Just like, I mean, in a lot of places, in a lot of industries, we have not provided the opportunities to women, minorities, et cetera, that, you know, that we should. I think the cannabis industry is addressing this issue. I mean, can you think of other industries that are, you know, proactively talking about social equity and providing opportunities and, you know, giving back to communities that have been disproportionately affected by the drug war? Like, we're having the conversation, which I think is a huge step forward. But I agree that a lot of states have not. But this is where I think the free market is better. You understand that in a state like Colorado, and I agree that we have a lot to work on when it comes to social equity, and we actually just passed a bunch of social equity laws very recently, and we're working on that in this state. But in a state where you actually have free markets, where people can apply even if they're small and don't have a ton of money, I think that creates more opportunities than in a state where you say our licensing or our application fee is going to be $50,000 or $25,000, and you're going to have to compete for these licenses. And what ends up happening is that these are technical applications. They're asking for the types of products you're going to be manufacturing, for example, or the types of plants you're going to be growing. What makes you special? How is your grow facility designed, for example? And I mean, it could be all mumbo jumbo, but if you go hire a really good expert and pay them $100,000, you're going to have a really nice application compared to somebody who maybe just did it on their own. And that's where we're failing, in my opinion. It shouldn't be like that. We need to be able to give everybody an opportunity. So in Colorado, if you want to apply for a cannabis license at the state level, you have to be 21. You can't have certain crimes in your background, so they're going to do a background check. And you know, you have to be, you know, that's pretty much the requirements. There's a lot more. You have to, of certain disclosures you have to make. You have to form an entity, et cetera, et cetera. But you know, it gives so many more people an opportunity than in a state like New York, which has, you know, 4 licenses or 5 licenses.
I think that I read, and I could be wrong. I could have the state wrong, but I don't think it's the principle I'm talking about. I think it was Oklahoma that came out and did both medical and recreational at the same time, and their licensing fees. I don't want to minimize them, but they were nothing compared to what some of the other states around the country and jurisdictions are charging for licensing fees. They wanted to be able to allow people to get into the business at an affordable price. If we get decriminalization at the federal level, do you expect to see a lot of huge expansion and the resources at the regulatory authority may not be capable of handling the demands?
About that. We have thousands of licenses in Colorado. There's thousands of licenses in California, Oregon, Washington, Oklahoma, probably Michigan. I think that if you create the right regulatory environment, it's not going to overburden the system. So I'm not really sure that federal legalization is going to create. I mean, it really depends on what federal legalization looks like in the first place. But I do think it's the right conversation to be had, that we should be talking about social equity. I don't know that anybody knows the right answer to social equity and how to make this right. And I think it's good that the federal government is considering that, but it is a balance of all these interests.
Yeah.
And we just have to be very thoughtful and you know, about the approach.
Unfortunately, we're out of time, Rachel. I want to remind the audience that we don't have a particular bias on this show, and because Rachel didn't agree with my position, that was okay, because you needed to hear both sides of the story. So I thank you for your openness and your candor and your honesty, Rachel, and thank you for joining us today.
I'm happy to be here anytime.
Good. If you missed any of this terrific interview, and you should go back and listen to it, and the other ones that she's done with Rachel Gillette from the Green Spoon Martyr Law Firm out of Denver, but she practices all over the country. You can go to W420radionetwork.com, and you can listen to this episode and many others. Hello, this is Dan Perkins from America's Cannabis Conversation, and I'm here to talk to you about CV Sciences, the company that developed the immune system support products called CV-Acute and CV-Defense. One of the questions I asked the company was, how safe and effective are these products? Recently, I interviewed Stuart Tonk on my show, and here is his response to my question.
Science supports it. CV-Acute and CV-Defense are backed by research, cited by the World Health Organization for immune system challenges. It's safely used in hospitals. That's right, CV-Acute is safely used in hospitals in Europe and in China.
If you want a productive immune system, you need to purchase both CV Defense and CV Acute. You can find out more information about both of these products at empoweryourself.info. Empower yourself and take charge of your response to COVID-19. You have the power to control yours and your family's health care. This is Dan Perkins, and thank you for joining the conversation. We hope you enjoyed the conversation today and invite you to join us next week. By the way, you can go to our website, www.America's Cannabis Conversation, and download previous shows, but also on the website, you'll be able to see who our guests are going to be next week.
W420radionetwork.com